Well, the COVID-19 outbreak isn't showing any signs of easing down. Experts warn the number of new cases will surge in the coming weeks. The 4 provinces with the highest number of confirmed cases are expected to see an even bigger spike. To discuss this, we've got Dr. Angelique Coetzee, chairperson of the South African Medical Association, on Skype from Pretoria. Very good morning to you. Before we get to the spike in COVID numbers, what do you make of this decision to fill taxis to capacity?
Good morning, and good morning to all the viewers out there. I think it is not the best decision that's been made. We keep on saying ad nauseam, there should be social distancing, 1.5 meters. There should be face masks. There should be hand washing or using any other form with alcohol-based sanitizer. So if you fill your taxi to maximum capacity, there is no ways that you're going to get 1.5 meters distance between the people. I understand that this is a financial, or this has got financial implications, but we need to make sure that our people are staying safe. As it is currently, especially in Gauteng, I do not know whether the viewers out there are aware of this, but most of the provincial hospitals for COVID patients is already full to capacity. I have heard yesterday, or I received yesterday from my members, a lot of WhatsApps telling us that there is no beds. People are lying in the corridors. There is no oxygen. So if you now, while we are going into the eye of the storm, we are now moving into the eye of the storm, then still insist to fill a taxi to maximum capacity, you are going to add to that burden, and a lot of your taxi drivers themselves are then exposed to this virus.
All right, so what can we expect then numbers-wise if we're overtaking the Western Cape, and is there anything we can learn from them in this regard?
Well, it seems we don't learn. We are overtaking them because simply on numbers, the Gauteng province are much more densely populated than Western Cape. We are Gauteng is currently the epicenter. It moved away from Cape Town. It is now in Gauteng. And as I said, especially in Joburg and the East Rand, there's a lot of problems regarding admission of patients with COVID-19. I'm not even talking about all the problems in the Eastern Cape, and KwaZulu-Natal is not far behind. I think one of the problems that people are not really aware what is happening in these public and private hospitals is because family members are not allowed, which is right. You should not allow family members. But unfortunately, the insufficiencies and the problems that's now been experiencing in these facilities are not then highlighted out there. It's now up to whistleblowers of doctors or nursing staff.
I mean, we'd love to get cameras in there, that's for sure. I was also shocked to find out that there are, in Gauteng, no field hospitals. How's that even possible?
Yes. Well, again, I think there's too many people in decision-making structures. So it's a no-brainer that the Nasrec must be fully capacitated and running. I'm not sure whether that is currently happening. Then there must be some place near, and this has been given to the National Department of Health and the Provincial Department of Health, especially in Gauteng, regarding having another dedicated COVID hospital around Midrand, and where the Dr. Johan Pretorius from Universal, Scott, they have a beautiful plan where a lot of the people out there, organizations, are giving and supporting that structure. But it's not happening because there's too many people in decision-making processes. And I think people are sitting there, do not understand what is really happening at the ground level. It is also not right for especially nursing staff to go on slow strike during this time of COVID. it's going to have disastrous consequences. Remember, it's not only on the COVID patient itself. If you go on slow strike, it's all the rest that goes with it. It's the non-removal of waste, the infection rate in the normal wards is going to escalate, and it's going to we're going into the storm, the eye of the storm of COVID, but we're also going to the eye of the storm of a lot of other problems experiencing in these hospitals.
Angelique, okay, thank you.